Welcome to Akathisia 101. I'm Christina Kaiser. I met Wendy Dolan years ago due to akathisia. We both do have education backgrounds, and today we are going to give you, I promise, the best overview of akathisia.
Hi, so I'm Wendy Dolan. I'm the founder of Induced. We draw attention to akathisia. And akathisia is a word that most people have never heard of. If you look at drug commercials on TV, may give you suicidal thoughts. This is what is known as akathisia. What's really important to understand is, so we come to events like this every year, and why I think I'm a social worker, obviously. What I think is so important is, and many times, an internist, a gynecologist, or a psychiatrist is prescribing the meds, and we turn out to be the ones that are managing the symptoms. And I think it's really important for people to be aware. We're not anti-drug, we're all about just awareness. So what is akathisia? It is a side effect that occurs when you stop, start, or change the dose of any medication. The outer symptoms are easy to watch, the pacing, the can't sitting still, but the inner symptoms are very difficult because I feel like my brain's on fire. I feel like a veteran I talked to, she said, I felt like I had a battery on my tongue. And so these symptoms may resemble anxiety, depression, or agitation, but it is a drug side effect. And I've dealt with clients, people who reach out to us, and they literally can't stop moving, even though they've stopped the drugs. It's a lifelong, and it's just heartbreaking. And this was a young man who took the drug because he had test anxiety, and now he can't stop moving.
So I'm going to introduce some of the symptoms: intense inner restlessness, urge to move, insomnia. Either they can't sleep or they have violent nightmares. And the nightmares are very vivid, and that might play out in terms of the intrusive, out-of-character thoughts. Perhaps the early symptoms might be you have a nightmare, and then during the day, that violent, intrusive thought becomes more to the forefront. Just remember this: akathisia is not limited to psychiatric medications, and akathisia symptoms, while they are psychiatric in nature, obviously many of them are adverse psychiatric effects. It has nothing whatsoever to do with why a person got the product or their underlying mental health.
I would never think that if I was taking Propecia for hair growth, that I would be at risk for becoming suicidal. So I think my thought is, anytime you start any new med or change the dose, if you start feeling different or you're developing symptoms that you never had originally, I think you need to talk to someone. And we're not doing a good job as clinicians unless we really say, hey, what's going on in your life? Any new medications you're on? So I think it's important for all of us to broaden our horizons, and that's why I think this kind of a conference is really important.
Many akathisia survivors who have had an experience that wasn't successful will tell you that they didn't know what they were doing, or if they did, they were just thinking, like if you're jumping from a burning building, you're just trying to stop the suffering, not end your life. All four types of akathisia have the exact same symptoms. They differ at onset.
It's acute, that happens right away. It's tardive, that handles, later on. Chronic, which goes on forever. And then there is withdrawal akathisia, which is getting a lot of attention. People say, I'm just going to go off my med.
But what we do say is that if your client or someone you know, they're at risk, you do need to go and seek emergency care, but you need to explain that it might be akathisia. A Harvard psychiatrist, Dr. Joseph Gletmullen, in the 80s when SSRIs were having the FDA hearings, he said himself, this is not a traditional suicide if someone dies from self-sustained injuries while suffering from akathisia. It's not a despair, it's not depression, it's like a medication-induced toxicity, if you will. It's called iatrogenic. Iatrogenic means caused by medical error, medical intervention, medical harm. We can't stress enough that this has nothing to do with someone's level of happiness before they start a medication. It's not related.
General takeaway, I hope for all of you, is starting, stopping, change a dose of a med. If you get new or worsening symptoms, it may not be you, it may be your med, and just to get help. I mean, we're passionate about this because our message isn't problematic. We're not anti-drug. It's awareness. Why shouldn't you be an educated consumer?
I do want to say before we take questions that while there's no definitive treatment, I don't want to leave anybody misbelieving that there's no management. We don't give medical advice, but what you'll learn when you take our course is that some of the traditional ways it's managed is to reduce the dose of the causative medication, to slowly titrate off the medication. We have 2 courses. One is NASW accredited. It's offered for free. It gets you one, CEU. We have another course that anybody can also take, but it's geared more towards consumers and caregivers. Before you leave, please go to the table on the right. There are QR codes for the free NASW certified course, Akathisia podcast, newsletters. Everything we do is free. We take no money from industry or the pharmaceutical companies. We're a 501c3 nonprofit just to increase patient safety.
And one last thing, all we ask of you is if you found our talk interesting, you go back to your agencies or whatever, where you're at, say, hey, I learned about akathisia, go to miss.co and just educate your staff, yourself, and others. So thank you. We're grateful for all of you. Thank you.